The government just released new Medicare rules for 2027, and buried inside hundreds of pages of policy are changes that could affect millions of Medicare beneficiaries. Some of these updates will make it easier to get help choosing a plan. Others could change how Medicare seminars work and how agents enroll people. And one proposal that could have protected patients when their doctors leave the networks was ultimately rejected. Hi, I'm Hannah Skinner, a licensed insurance agent at the Senior Savings Network, and today we're breaking down the new Medicare rule changes, what they mean for Medicare beneficiaries, what they mean for agents, and the proposed change that could affect millions of people in Medicare Advantage networks. If you're on Medicare or turning 65 soon, these changes could directly impact the coverage decisions you make in the next few years. Every year, the Centers for Medicare and Medicaid Services, commonly known as CMS, releases updates to the rules governing Medicare Advantage and Medicare Part D plans. The new rule for contract year 2027 includes policy changes affecting Medicare Advantage plans, prescription drug plans, marketing regulations, enrollment procedures, and how Medicare plans are rated for quality. The rule itself is hundreds of pages long and includes dozens of technical changes. But buried inside that document are several changes that directly affect consumers and agents. Some of these changes are designed to simplify Medicare processes. Others are meant to reduce regulatory burden on plans and agents. And some proposals that were discussed earlier ultimately did not make it into the final rule. Let's start with one of the changes that will immediately affect how people talk to Medicare agents. If you've ever met with a Medicare agent before, you may have heard of something called a Scope of Appointment Form, or SOA for short. This form is required before an agent can discuss specific Medicare products with you. It basically says, these are the topics that you're agreeing to talk about. For example, if you scheduled a meeting to discuss a Medicare supplement with an agent, they shouldn't start pitching Medicare Advantage plans unless that was included in the scope. Historically, there was a rule that required agents to wait 48 hours after receiving that form before the appointment could take place. The idea behind that rule was for consumer protection. It was designed to prevent high-pressure sales situations where someone might be pushed into enrolling immediately. But in reality, it sometimes caused major frustration. Imagine calling an agent because you need coverage immediately, and they have to say, I'm sorry, we legally have to wait 2 days before we can even talk. Under the new 2027 rule change, the waiting period has effectively been removed or relaxed, allowing agents to collect the form and have the meeting right away. For beneficiaries, this means faster access to help, same-day consultations, quicker enrollment assistance. But it also means consumers need to be more aware of who they're working with. Because when rules loosen, the responsibility towards education and transparency becomes a lot greater. Another change involves educational events. If you've ever attended a Medicare seminar at a library, community center, or restaurant, that was likely an educational event. Historically, these events were supposed to be information only. Agents could explain how Medicare works, the difference between plans, how enrollment periods work, but they could not sell plans at those events. If someone wanted to enroll, they had to schedule a separate appointment for later on. That separation is now changing. Under the updated rules, enrollment may now be allowed in certain situations following educational events. This means someone attending a seminar could potentially move forward with an enrollment without needing a second appointment. On the positive side, this makes things much more convenient for beneficiaries. On the other hand, it raises an important question. When you attend a seminar, are you going for education or are you attending a sales event? Some consumers attend educational events expecting neutral information, not realizing the presenter may now be able to enroll them on the spot. That's why transparency matters more than ever. When attending a Medicare event, ask, is the presenter independent? How many companies do they represent? Are they explaining all of my options? Because Medicare decisions should always start with education first. At the Senior Savings Network, we're able to host both in-person seminars for our South Carolina people, as well as virtual seminars for our viewers all over the country. Now let's talk about a rule that many advocates were hoping would change, but didn't. One of the most discussed proposals in the rule was the idea of creating a special election period when doctors leave a Medicare Advantage network. Here's the issue. Provider networks change all the time. Doctors retire, hospitals renegotiate contracts, medical groups switch insurance partnerships. Some patients find out their doctor is no longer in the network mid-year. Unfortunately, your doctor or hospital leaving the network does not make you eligible to switch your plan in the middle of the year. Many advocates wanted CMS to create a special enrollment period allowing those patients to switch plans if this happened. But CMS ultimately did not move forward with that final rule. You might be asking, why not? Well, critics speculated that if this rule change were to pass, that predatory agents might use this to change people's plans unnecessarily. They could advise you to make up a fake doctor that they know will be out of network so they can change your plan even if it's not in your best interest. So as of now, if your doctor leaves the Medicare Advantage network during the year, you may not automatically qualify to switch plans. This is why reviewing your plan during the annual enrollment period is extremely important. Just because a doctor is in your network today doesn't mean they'll be there next year, because networks can change. And unfortunately, there isn't always a mid-year exit when that happens. Another major part of this rule change involves changes to the Medicare star rating system. Star ratings are the quality scores given to Medicare Advantage plans and Part D plans. Plans can be rated anywhere from 1 to 5 stars. These stars measure things like patient outcomes, member satisfaction, access to care, and medication safety. The new rule proposes moving several measures from the rating system to simplify how plans are evaluated. CMS says the goal is to focus more on clinical outcomes and meaningful quality improvements rather than administrative metrics. This change would reduce the number of measures used to calculate ratings and emphasize the metrics that matter most to patients. Why does this matter to you? Because star ratings influence plan bonuses, marketing advantages, and how consumers compare plans. Plans with higher ratings often receive financial bonuses and stronger visibility on Medicare's Plan Finder tools. So changes to the rating system can significantly impact how plans compete in the market. Another important part of the 2027 rule changes continues the rollout of major changes to Medicare Part D prescription drug coverage that were originally passed through earlier legislation. These include updates to the prescription drug benefit structure, how manufacturer discounts work, and how certain costs count towards the maximum out-of-pocket spending. Over the past few years, Congress and regulators have been gradually redesigning how the Medicare prescription drug program works, and the 2027 rule changes continue implementing pieces of that redesign. One of the biggest changes involves the overall structure of the Part D benefit. Historically, Medicare Part D had several different coverage phases throughout the year. Beneficiaries would move through a deductible phase, then the initial coverage phase, then the coverage gap, often called the donut hole, and eventually they would hit catastrophic coverage. That structure was complicated and often confusing to beneficiaries trying to understand how much they would pay for medications. Recent reforms have been working to simplify that system while also shifting most of the financial responsibility towards insurance plans and drug manufacturers, instead of placing so much burden on beneficiaries. One of the most significant changes that has already started taking effect is the introduction of a true annual out-of-pocket cap for prescription drugs. Beginning in recent years, Medicare beneficiaries now have a maximum out-of-pocket for how much they'll pay on prescription drugs during the year. Once a beneficiary reaches the amount in their out-of-pocket drug spending, their covered prescriptions for the rest of the year should essentially be paid for by the Medicare program. For many people who rely on expensive medications, this represents one of the largest financial protections ever added to the Medicare drug program. The 2027 rule also continues implementing changes related to manufacturer discounts and cost sharing. Drug manufacturers are now required to provide larger discounts once beneficiaries reach certain spending thresholds, which helps reduce the financial burden on both Medicare and the individual enrollee. All of these updates are part of a broader effort to modernize the Medicare Part D program. Last but not least, Medicaid is getting some major changes as well. The proposal introduces new work requirements for many adults, meaning that you would need to work, volunteer, or participate in job training for about 80 hours per month just to keep your benefits. But it's not just about work requirements. There are also stricter eligibility checks and more frequent renewals, which means even people who still qualify could lose coverage simply because of paperwork issues or missed deadlines. On top of that, federal funding for Medicaid is being reduced, which could force states to scale back benefits, limit enrollment, or make it harder to qualify in the first place. Between the new rules, funding changes, and administrative hurdles, experts believe that a significant amount of Americans may fall off of Medicaid within the next several years. Medicare isn't being cut directly, but there's a major ripple effect. Many seniors rely on Medicaid alongside of Medicare to help cover costs like Part B premiums, prescription drug costs, and copays and deductibles. These programs, often called Medicare Savings Programs or Extra Help, could be impacted if Medicaid funding shrinks. Here's the bottom line. Medicare rules change every single year. These changes often happen quietly inside hundreds of pages of federal policy. Most people never hear about them until they affect their plan, their doctor, or their prescription coverage. That's exactly why we make these videos. Our goal is to break down complicated Medicare rules in plain English so that you can make confident decisions about your healthcare. If you found this helpful, make sure you subscribe to the channel and share this video with anyone who is on Medicare or turning 65 soon. If you have questions about these new rules, drop them in the comments below. Thanks for watching, and we'll see you in the next video.